Good morning, everyone, and thank you for joining us. I'm Nicole Dupuis, the Chief Executive Officer for the Windsor-Essex County Health Unit. With the reintroduction of students to the classroom this week, the Health Unit has been actively working with school boards, health and safety representatives, and principals to ensure students have the best opportunity to study and learn safely. With recognition of the benefits of in-person learning, it is our goal to keep students in the classroom and minimize the disruption to their learning as much as possible. To achieve this goal, the local context, case rates, and vaccination rates must be considered and decisions made to ensure that kids can continue to stay in the classroom. Over the course of the past few weeks, the Health Unit has made a number of recommendations to our school boards and private schools, among them a recommendation to delay the introduction of extracurricular activities until October. We've had a lot of questions about this recommendation. This recommendation allows for time for students to get into the classroom for learning and to ensure time for public health to monitor the rate of transmission and respond. Our region has one of the highest number of COVID-19 cases in the province and one of the lowest vaccination rates amongst youth in the province. We understand and promote the importance of extracurricular activities and what they add to a feeling of community and well-being for children and youth. However, reducing transmission and keeping kids in school for learning must be our top priority. We know a delay is disappointing for students, athletes, clubs, and other groups, but we stand by our decision and recommendation and are encouraged that our local school boards have implemented this alongside numerous other practices which were brought forward with the best interests and evidence for students and families in mind. The measures implemented both locally and provincially throughout this pandemic have made a measurable impact on the rate of transmission in our community, but it's not up to public health, and we cannot do this alone. Public health guidance is only effective when it's followed. To get through this fourth wave, the contributions of every individual and family in Windsor-Essex is needed. Each day you make choices that affect your health, the health of your family, your school, community, and Windsor-Essex. More than ever, importance of staying home when you are sick, especially for school-aged children and their families, will be a critical factor in fighting back against COVID-19 and the Delta variant in our community. Our message today to every parent and guardian in this community is that your decisions will be the most important factor in how quickly we move through this fourth wave and whether or not students stay in the class. It's up to you as parents to screen your child before sending them to school and to keep them home if they are sick. Don't ignore symptoms of COVID-19. Complete the online screening, do so honestly, and make a plan for childcare in the event that your child can't go to school. For those parents with children who are eligible to receive the vaccine, this could be the difference between keeping your children home or sending them back to school if someone in their class becomes sick. Please encourage your children to get the vaccine and plan time your schedules to make this possible. There are walk-in appointments available every day, and we encourage you to do so. The only way to get through this fourth wave is for everyone to do their part. We're here to guide and support you, provide you with the tools needed to make the proper decisions, and have embraced the difficult responsibility of putting measures in place to protect you and your families. While we encounter protests and resistance, we want to remind our hardworking team and staff of the importance of their work and personal sacrifice for the health and well-being of our community. And we all look forward to a time where we can look back on the pandemic and be proud of the work we completed to minimize the devastating impact of COVID-19 on our residents that we aim to protect. To review our health unit's recommendations for schools, you can review these in our school Return to School Toolkit online at www.wechu.org. Thank you. I will now hand it over to Dr. Ahmed for his final epidemiology update as he moves into his new role as Associate Medical Officer of Health for the Province of Ontario. And again, just want to thank him for his service and his support of our community and truly his fearless leadership. Have a great day.
Thanks, Nicole, for the thoughtful words. And before I jump into the presentation, I would definitely want to echo what you have said in terms of the sacrifices and what we have done so far in this pandemic. This pandemic has never been easy for any of us. There have been many, many instances where everyone was challenged by this pandemic in so many different ways. And no different is our staff and everyone who is trying their best to contain the pandemic as best as possible, to protect the health and well-being of our community, to protect our healthcare system, to protect everyone in our community. And it's not the time that we continue to debate whether we like something or not. It's not about liking. It's about playing our part in containing the pandemic, which is affecting everyone. And on that note, as we see that the data across the world and in Windsor-Essex continues to show the increase in the fourth wave activity. So throughout the world, as we can see, that cases continue to rise, and there have been some occasional decrease, but then there have been increases in some of the other countries as well. So if we are looking at UK, which is pretty much open for the most part, they continue to see lots of cases. In US, where the vaccination rate is not that greatest, and they are experiencing somewhat similar to what they have experienced in the previous wave. But other countries like France, Germany, they are starting to see a decline after containing some of these, after curtailing some of the reopening that they have done to bring the cases and the impact on the healthcare system to a better level. When we're looking at the number of patients that are hospitalized, it's also increasing. It's not at the same level where it was before, and we can attribute that to the vaccination, but still the number of patients that are in the hospital system is significant enough to have a huge impact on the overall healthcare system. And we can see the impact in US, we can see the impact in other countries. Similarly, when we are looking at the ICU picture, our ICUs are also impacted by it, and US is leading them with the number of patients who are currently in the ICU bed. A stark increase compared to some of the other countries, and also pretty much going back to the peak of the ICU admissions, similar to what they have seen in the peak of the third wave, which is concerning and a reminder that how things can quickly go from bad to worse. Most of that contribution, what we are seeing in throughout the world, is as a result of Delta spread. And in Canada, now we are at a point where 95% of our cases that are reported are the Delta variant. And similarly, in other countries, the Delta variant continues to cause most of these issues. In Ontario, we are seeing that the current case rates in Ontario is rising, and our 7-day average is about 732 cases a day, and it is at a level where it is causing an impact in pretty much most of our community. It is translating differently in Windsor-Essex. Obviously, we had a pretty good run with the third wave. We did very well post-third wave, and now we are coming to a point where we're seeing the cases that are similar to where we were before in the third wave. Our average 7-day average cases are now up to 70 cases per day, which is a significant increase compared to where we were before a few weeks ago. And when we're looking at week-over-week case rate, our weekly incidence, right now it stands at 113.8 cases per 100,000 population. This is an increase again from last week where we were at 110.1 cases per 100,000 population. And just in the last 7 days, our case rate continues to be the same at 113.4 cases per 100,000 population, which is an increase as well. I'll just skip this slide, but basically just showing that how we are doing compared to the rest of the province and the Southwestern Ontario. We are leading with the case rates, not a good sign from where we were before. Our wastewater surveillance data is reflective of what we are seeing in the community, despite the fact that this is still a research method that is being used, but the data that was collected with this study is pretty impactful in the sense that it aligns well with our case rates, and looking at that, it continues to show that the cases are happening in our community. From a person positivity perspective, our person positivity is increased to 9.3%. This has been the highest that we have seen in many weeks, even higher than the third wave that we have seen. Overall, in the last weeks, the test numbers are increasing, but just in the last 7 days, our person positivity is the highest in the province, and it is a concern when we are comparing ourselves with the rest of the communities. Breaking it down by age, and not much of a difference, but remarkably, with the 0 to 17 age group continues to show with the highest person positivity, recognizing that a lot of them are currently unvaccinated or not eligible for the vaccination. The rest of the age bands are eligible to receive the vaccination, but among the age bands that have a lower coverage rate, we see a higher person positivity in that age band as well. From a cumulative regional and provincial rate, our cases, Windsor-Essex continues to have the fourth highest rate and is higher than the provincial average, which is represented in this graph in the yellow line. Breaking it down to municipality, just in the month of September, which is last 7 or 8 days, and the majority of the cases that we have seen came from Kingsville, followed by Leamington, and then City of Windsor continues to have a relatively stronger share of these cases. From a case distribution perspective, our cases are mainly distributed in the City of Windsor, 63% of the cases, while the rest of the municipalities are pretty much similar to each other with the exception of few. In the last 7 days, similar picture, same data. From an age and sex distribution perspective, as indicated earlier, the younger population, they continue to get more disease with a higher person positivity. And when we are looking at the 0 to 29 age band, we can see that almost 1/4 of our cases are coming from that age group. And again, highlighting some of the importance of the vaccination and keeping our schools safe. We know that anyone who's under 12, they're not even eligible to receive the vaccine. We know that the Delta variant spreads very quickly in an indoor environment. So you just need 1 or 2 cases in an indoor environment for the Delta to spread very quickly. So when we're talking about all these public health measures, and especially when we're talking about the school-based measures, that's really important to understand what we are dealing with. And then when we're looking at some of the other age bands, are also showing the similar picture from 20 to 29, and if we lump them all together, that makes up like half of our cases in our community in the last 2 weeks between the ages of 0 to 29. And almost 65% of our cases is under the age of, between the ages of 30 to 39. So that's pretty significant, and that's where our vaccination coverage rate is the lowest. From an exposure perspective, not much difference. We continue to see a similar picture from a community spread perspective, contributing to approximately less than 1/3 of the cases in our community, followed by the household context, which is not a surprise given the Delta spread. And so this data basically looks at different types of variants of concern that were identified in our community, and as we can see, everything that we are seeing in our community in the green bars are representing Delta. So everything we are seeing in the community is the Delta right now. From a hospitalization perspective, our hospitalization is starting to pick up, similar to what we are seeing in the province. And in fact, if you look at the tail end of the data, it shows that we are slightly above the provincial hospitalization rate at this time. Similar picture from an ICU utilization perspective, it is trending upwards in the province as well as in Windsor-Essex. From a case doubling time, day-over-day comparison perspective, the line in the blue, which is Windsor-Essex, we have the lowest doubling time compared to the province, as well as compared to the entire Canada, signaling that our cases are continue to worsen, and we'll have more cases if the trend continues. Looking at the median R naught is right now it's standing at 1.06, and again, this is slightly up from the last week when we were at 0.99, but this minor fluctuation continues to happen. We would like to keep the R naught under 1, which basically means that every existing infection would lead to less infection compared to where we were before. So we are at a stable point, but still, given the high number of cases, active cases that we have, and with the trend that we are seeing, we'll see cases on the rise rather than cases on the decline, but we'd like to see cases decline. Now, switching gears to talk about some of the vaccination status, and I'll move through these slides quickly because we talked about it quite a lot. So this graph basically shows the people who have received at least 1 dose of COVID-19 vaccine, and as you can see, some of the other countries are taking the lead compared to where we were in Canada, even with single and double doses. It's absolutely important that we need to increase our vaccination coverage rate up to almost 90% to contain the Delta spread in our community, given we have a significant number of people under the age of 12 who are not even eligible to receive the vaccine at this time. This is the number of vaccine doses that are administered daily to Windsor-Essex residents, and in the past 7 days, we have seen a slight increase in the number of first doses. We are now administering about 570 first doses daily, and this is up from last week when it was 400 first doses, which is a good sign that some of the measures, some of the cases that are happening in the community is encouraging people to get their vaccine if they were delaying it for one reason or the other. We definitely like to see those numbers increase, especially in the younger population. Another way to look at the breakdown of the first and second doses, but similar information, nothing new here. This particular slide shows the overall doses that are being administered compared to where we were before, and that includes both the first and the second dose. So we are just over 1,100 doses overall compared to the 920 doses that we were seeing last week, so an increase from last week. And as I indicated earlier, most of them are the first doses. Similar data, so I skipped that. From a coverage perspective, we are seeing improvement in our numbers with the first doses, and also seeing a gradient effect overall from the younger age to older, younger age with less coverage, older age with higher coverage. This is for the first dose. The residents that are fully vaccinated by age group, we continue to see some of these data. And on the same note, as Nicole mentioned, in terms of the schools, 12 to 17 years age band, we have 55.2% coverage, which still is telling us that almost half of the individuals who are in the school at this time are unvaccinated. So every other person in the school is between the ages of 12 to 17 could be unvaccinated. So something that helped us in terms of making some of these risk assessment and providing our recommendations on that. Get that slide. So vaccine coverage in Windsor-Essex hotspots with at least 1 dose administered, numbers improving slightly, but still much lower than what we are seeing from an overall coverage perspective. This slide shows the vaccinated coverage that are fully vaccinated. Again, some improvement, but still below where we are from an overall community perspective. Comparing our data with the rest of the public health units, so we are somewhere in the lower middle part of the entire health units from a coverage perspective with at least 1 dose, and that number is slightly lower again when we're comparing ourselves with the fully vaccinated individuals. We used to be leading the numbers with the early gain and the early effect of the vaccine and the community rolling up their sleeves to get vaccinated, but now we are falling behind. So this slide basically shows the impact of the vaccination with the cases, and now we are to our 4th wave. But this wave, fourth wave, is generally in the individuals who are unvaccinated. So this slide basically shows the risk of infection among those who are unvaccinated is 5.76 times higher than it is for those who are fully vaccinated. And given we don't have the data, enough data to make that analogy, but clearly what we are seeing in the hospital systems are also those who are developing severe disease are individuals who are unvaccinated. When we are looking at the breakdown by age of individuals who are unvaccinated versus fully vaccinated, and we can see that the trend and the graph basically is showing that the number of cases, even we are seeing 0 to 11 age band, we are also seeing number of cases in the 12 to 17 age band, but the highest continues to be in the younger adults, 18 to 39 years of age. In summary, our cases are continue to increase. We are at a point where our case rates are similar to what we have seen in the third wave. On top of that, the complexity of the investigation, the complexity of the work has increased significantly because every individuals now have multiple exposures because they are allowed to go into various business settings, business establishment, can do various activities. So we continue to see challenges in terms of case and contact management and containment of the disease, and leading to a significant impact on our public health unit resources, just with the complexity of the cases, not necessarily with the case numbers, but the complexity of the cases when majority of the things are already open. Our wastewater surveillance data continues to show that our cases are in that zone where we can expect that the cases will continue to increase or at least show up with the same number in the next coming weeks and triggering some further public health measures. Looking at the COVID-19 related hospitalization and ICU admissions, it's also on the rise. And with the announcement of the vaccine verification system and some of the policies, there has been an uptake in the first and second dose administration. We would like to see that increase ongoing to give the best protection possible to our community to fight off this COVID pandemic. Thank you.
We'll now take questions from the media. We'll start with CTV.
Yes, good morning. Now that school is back in person, what is the protocol for when there's a positive case this year in comparison to last year?
Nicole, do you want to take that question?
Sure. Okay. So our protocol is pretty similar to last year. If there is a positive case, we conduct our case and contact tracing. We'll do our investigation and ensure that we've confirmed that it is actually a positive case. And then as part of that contact tracing, we'll look to see if the individual was in school during their period of communicability. If they were, the classroom cohort are all considered high-risk contacts in that case. This is similar to last year, and they will instruct the school to dismiss those students. If they're in school, they'll be dismissed usually within the day. And if it's in the evening or after hours when we're contacting them, we'll inform the school and they'll instruct them not to attend school for that day. And they'll receive instructions for testing and isolation from the health unit. The only main difference, I guess, this year versus last year will be an assessment of vaccination status because it does change potentially can change the duration if individuals have to isolate or the duration of isolation.
Okay, and what is the tipping point to send students back online learning as opposed to in person?
So if you're talking about, closing an entire school, I'll turn that back to Dr. Ahmed and see what his response is.
Yeah, so that's a good question, Melanie, and currently that's being discussed at the medical officers of health level as well, that what are the numbers that we should aim for, and not that any number is good, but I think it also depends on the contextual situation of these outbreaks. So that's why when we made that decision last year, it was based on a number of factors, including the community transmission, community spread, cases that are coming in from the community, and the specific risk that needs to be mitigated in the school system. So we don't have a set number in our mind at this time, and that's why it is important that we monitor the data very carefully. And some of the recommendations that we have put forward, and including the extracurricular activities, is for that reason. We want to see what kind of an impact it would have in the community. When we are looking at our cases, I was not expecting that we will be at that high level of cases at this time of the year, but here we are. So we will have to wait and see that with all the measure that is currently in place in the school system, how they are working. And if there isn't a risk, then we'll have to come back to that. But unfortunately, I don't have a set number to give you that what would be our threshold.
And I guess something the parents are probably wondering is what the chances are that they will have to return to online learning, and if that's something that you anticipate is going to happen, given that our cases are so high at the beginning.
Well, it's possible, but definitely not something that we want. None of us want, and not only from a public health perspective, but also from an education perspective. Education is our top priority. So some of the measures that we are proposing right now is to do that, but the likelihood of closing the school, it would have to be in exceptional circumstances that we will see that without closing the school or without switching to online learning, we will be in a very difficult spot. That will be the only trigger in my mind, in my opinion, that we'll have to make that decision to switch to online learning. But at this time, we're not contemplating that. We are hoping that things will continue to improve in the community, in the school system, to help our children continue to get the best education possible.
Okay, thank you.
Any questions from CBC?
Yes, I had a few questions regarding the daycare outbreak that was announced yesterday. Discovery Daycare is located inside Kingsville Public School. Was the daycare ordered to shut down before classes resumed?
Yes, the daycare was ordered closure on August 27th, I believe, and since then we continue to see the spread among the dismissed. So it started off with with one cohort, and then it spreads to other cohort, and right now we are seeing more than 40 cases in that is a link to this Discovery Daycare.
Do you have any update? Like it's more than 40. Is it more than the 41 reported yesterday?
I haven't looked at today's data. We'll have our meeting later in the day to reconcile all the data and information. But as of today, I think that's the number that we have shared, 41 cases yesterday. That's the number that I have until the time we get to the time when we update the data.
And these cases, does the 41 only include staff and students, or does it include family members who might have been infected as well?
So most of these cases on our investigation are students with few staffs that are impacted by it. I am not 100% sure if we have included some of the family members. Last time when I look at the epi summary, it didn't include any family members. It's mainly the students and the staff.
Thank you very much.
Any questions from AM 800?
I have a couple for Nicole and a couple for Dr. Ahmed. Nicole, just your opening remarks. Seems like you want to get that message out there again. I know there's that protest. Bob mentioned it yesterday. There's that protest happening tonight in front of the health unit. I guess, why did you feel it was important to get that message across again? Do you think some are not getting the message why the health unit postponed extracurricular activities?
I mean, we've had a lot of questions. Yes, you were correct. There are, we understand there's a protest related to some of the recommendations that we have made. Where our vaccination clinics are being protested as well. And I know I've mentioned before that we're having, difficulty, I think, in some of our follow-up as well, when trying to follow up with cases. So it is important to us that the community does understand our role, where our recommendations come from, that they're based on our experience, our local context, and our evidence. We want to impress upon the community that the number one priority, and as Dr. Ahmed just said, is to keep kids in school for learning. We all recognize that that's where they need to be for their mental health, for their well-being. And so to make, we need to make decisions to make that happen and ensure that happens. And we also want to make sure that we're able to respond if there's a dismissal or an exposure in the schools. And delaying activities just enables us the opportunity to monitor the situation. Kids have been out of school for a really long time. They're out of practice, let them get back into the classroom, and that's where they need to be. And then introduce slowly some of those other activities so that we can all ensure that it's safe and we're able to respond. So yeah, it is important for us to be able to get that across. And I think the other key message that we want to get across is that this isn't just up to public health, it's up to all of us. I'm a parent myself, I have 3 children in school, and it's up to me every day to ensure that I'm screening them, not ignoring symptoms or fluffing them off, and making sure I take that responsibility. And measures, they're just guidance and recommendations, and all we can do as public health is guide our community. And it is up to us as a community how well we do. And so yeah, it is an important message that we want to get across, and just share that we're all in it together, because we are.
Thank you, Dr. Ahmed. Yesterday I asked you in regards to the new restrictions that were put in place, and you mentioned that the health unit met with some businesses. I saw a post on social media from a business owner talking about that meeting, and according to this post, I was trying to get some clarification to see if it's accurate. During that meeting, you mentioned that the midnight curfew was put into place because the health unit does not have funds to staff establishments after midnight. Is that accurate? Is that correct? That one of the reasons why the 12 midnight closure is in effect because of the health unit doesn't have the funds to support, I guess, enforcement officers at that time?
Absolutely not. So I'll just even modify the wording, because I don't like that word. And I said this even at the call, this is not a curfew, period. So if you're trying to use these words to gain some kind of attention or momentum, that's not right. So let's just take that word away. It's an early closure letter of instruction. They're instructed to close the business early, which for the most part, it's early is midnight. And when we're talking about midnight, most of the businesses are already closed at midnight. So what are we talking about? I don't know. And on top of that, what we articulated together, among many other things, which is obviously the first and foremost, is the risk that is associated with these businesses. When we're talking about those risks, we presented data, because I think that was the request for the most part, that what information you are using to base your decision. We use data to justify what is happening and what are the potential control measures that we are putting in place to help them understand. Like Nicole mentioned, we are in this all together. We can only get through this pandemic when we are looking after each other and supporting each other in the best possible way. Closing your business at 12, it's not going to disrupt the entire community. It would impact your business. I get it, totally get it. But it's a better compromise rather than we continue to let the high risk activities continue to get to the point where we start talking about, okay, the cases are out of control. The hospitals are full of ICU beds and patients in the hospital. We need to maybe shut down everything. Is that the discussion that we want to have with the community? or we want to have a discussion that, okay, how can we reduce the risk so we don't get to the point where we start talking about shutting down or closures. So it's a fine balance. I can see that people, I mean, it's not a popular decision with the businesses that are operating. I get that part. But my job here is to help you understand what are some of the rationales, why are we are making some of those decisions. And at the end of the day, how are we keeping our communities safe? What are we doing to keep our communities safe? With the data that is in front of me, if I'm not taking any action, I'm not doing my job. So the data is the data. We're telling you that this is where the impact is. This is where the activities are happening. And this is what we are doing to contain it instead of completely shutting it down. When we're talking about when the vaccine verification system kicks in, we'll reassess the data. We'll look at what our community situation looks like. And do we need to maintain some of these measures or not? So we will be looking at it. And I think it is something that we will look again when we are in a better spot.
Thank you.
Any questions from Blackburn?
Nope, all asked and answered. Thank you.
Any questions from Windsor Star?
Yes, good morning, Doctor. Good morning, Nicole. We're getting questions from some individuals who are wondering why community youth sports are allowed to continue when those include children from multiple schools. It's believed that those would just be more high risk than extracurriculars involving just children from their own school at that school. So can you comment on community youth sports and the risk level involved there?
So I'll start to answer that question first, and maybe then Nicole can add her pieces if she likes. So we're talking about is community sports, and so think about it that way. If let's say if we take that step and we do that, then the next question would be, well, the kids can already go outside and do and organize some play. They don't need permission from anyone else and do whatever that's needed to do. Extracurricular activities, it's an organized activity. It's something that is happening with some organization in place, which is intentionally bringing people into that fold to participate in those activities. We know we have seen some of the other activities that would impact the school system the most. Obviously, I can't tell a parent how they're keeping their children at home. But there are certain things that we can do from a school safety perspective, that how we can keep that school environment safe. So that's why the recommendation is for the schools. If at one point we feel that the activities that are happening in the community is high risk and we need to take some action, we will take some action. But right now, the recommendations and the focus is to keep our schools safe, keep our education going on for our children. Our children have lost a significant amount of time learning online, and everyone is impacted by it. It's not a good thing for us as a community, as a country. We are struggling. So we definitely want to focus our attention on the education at this time, and we will revisit the whole idea of extracurricular activities, engagement of students in other type of activities when things starts to improve. But right now, our focus and attention continues to be the education of our children.
Yeah, I'll just.
Thank you for that, Doctor. And I asked, okay, go ahead, Nicole, sorry.
It's okay. I was just, it's okay. I think Dr. Met covered it. I'll go. You can go back.
Thank you very much. Okay, and Doctor, I asked you this question last week, but I'm just going to ask it again in case anything else has come up. Why is Windsor-Essex being hit so particularly hard right now when we see that in most of the rest of the province, things aren't quite as bad as they are here?
Well, I think, as I said, we are a victim of our own success. We did remarkably well with everything that we have put in place in terms of control measures, in terms of containing the disease, in terms of getting the vaccine. We did exceptionally well. We were the leaders in the province. We did everything that we could to get our cases down. have some of those restrictions in place, have a higher vaccination rate. But unfortunately, when things start to open up, which basically allow people to come in together in a bigger number, and when we look at the absolute number of people who are currently unvaccinated, that's how I use that number, 12 to 17 age group, even though that they are eligible to receive the vaccine, but our fully vaccinated coverage is just 55%. That means you still have 45% of the people who are unvaccinated, the children between 12 to 17. That, if you further translated, that means every other child that you're meeting, one would be vaccinated, one would be unvaccinated, one would be vaccinated, one would be unvaccinated. So you can imagine the number of people who would be vaccinated versus unvaccinated. And we know that when Delta starts to spread, it spreads very quickly. In these settings, what happened with all the success and everything, people stop to take some of these, implement some of those measures. All the provision that you're looking at in our letter of instructions, it basically addresses some of the challenges that we are seeing. The businesses who are supposed to collect information from individuals, they are not collecting that information. The businesses that are mandated to wear a mask in the indoor setting, they were not enforcing some of those measures. The number of people who are supposed to be in that particular business establishment, that's not being followed. We looked at all of that investigation data. We looked at all of the information that we are seeing, and we felt we were, and we were not wrong. We were in a very good spot with our cases that are dropped down even to, I believe the lowest we have seen is less than 25 cases, active cases in our community. So that was really good news for our community. But then that gave the impression that the pandemic is over and we don't have to worry about it. And that's leading to all of this spread. I can start to see that people are now realizing that fact, and then they're trying to curtail back and start taking some of these measures. But throughout the pandemic, we have seen once cases hit a certain threshold, it takes longer for us to contain, and it will take much stronger measure to contain. So we definitely don't want to even see the situation get further bad before we start to take more drastic measures. So it's unfortunate that we become the victim of our own success with everything. But those are my thoughts based on the investigation that we have seen with our local case and why we are seeing more cases than other regions.
Thank you, Doctor. I'll just finish with saying congratulations on your new position and best of luck in Toronto.
Thank you, Taylor.
Any additional questions from CTV?
No, thank you.
Any additional questions from CBC?
Yes, just one more. There's 5 outbreaks in agricultural settings right now. Do you have a sense of how big these outbreaks are? Any concerns about those?
So far, those outbreaks are fairly well controlled. We haven't seen the significant number that we have seen in the previous outbreaks. These outbreaks are obviously prioritized for follow-up to ensure that it doesn't get worse. Our team is on top of all of these outbreaks. If things change, we'll definitely put additional measures as we need to. But right now, all these cases are under control for the most part. Or these outbreaks are under control for the most part.
Thank you.
Any additional questions from AIM 800?
Nicole, non-COVID question, if that's okay. Just in regards to beach testing and the mosquito testing, when does that wrap up?
Actually, Dr. Ahmed may have a better idea of when that ends. I'd have to check with the team to get the exact time frame.
Yeah, so Rob, the mosquito testing, it typically it's dependent on the weather and the mosquito activities. There were a time when we finished the activities up until mid of October, and other instances end of September. So that's for the mosquito activities. I believe the beach testing would conclude soon. We do have a set timeline for that, and if it should be coming in a week or two. I don't have the exact date, but yeah, beach testing time is pretty much set, and the mosquito is basically based on the temperature and what we're noticing.
I guess with those two programs, Dr. Ahmed, I know they take time and resources. Last year, the beach testing was suspended. Just to reintroduce it this year, are you pleased with how everything went?
No, absolutely, and I think we were more than happy to do some of the other public health works rather than just focusing on COVID all the time. It also gave our staff the ability to do the work that they do otherwise in the non-pandemic time. Overall, I think it went well, and we wanted to remind that there are other public health risks that are out there that our team are continuously fighting every day. And the unfortunate reality of public health is when things are going well, it's because the staff that are working behind the scene to keep it that way. And when things get really bad, then we start to notice some of these public health issues coming out in public attention. So kudos to our staff, and our staff has done an amazing job. And I can't thank them enough in terms of what they have done throughout this pandemic. As everyone is thinking and everyone is feeling the pressure of pandemic, no one has felt that pressure of the pandemic more than our staff. The hospital staff, the healthcare workers, every one of us have been constantly giving our more than 100% every day to keep to the level where we are. We are a smaller or a medium-sized health unit, but despite that fact, the work and the effort that all of our staff has shown is remarkable. It has been acknowledged by every level of the government, and they can see what we have done for our community. And I don't want to take up too much time, but I think it's the unfortunate part is when we hear about some of these community protests, and people are trying to use that as a means to register their protest. Sometimes I wonder, where should I register my protest? Where should I go and do that? Because that's the job that we are doing. Our health unit team, if people are putting that pressure and intimidating us, it's not going to help. It's not going to be helpful for the entire community. It would be detrimental to the community to say that, yes, well, you want this? Okay, go ahead and have it. And then, we start to see some of that impact in either in our school system, in our healthcare system, everywhere. It will not go well. And we have seen people die because of COVID. People who have recovered, they have some of them have long-term sequelae. People, if you are lucky and you didn't contract COVID, great job. You have done excellent, but don't underestimate the disease, and don't underestimate that how it can be damaging to an entire family, to people, and to the entire healthcare system in our community.
Like Taylor said, thank you very much for everything.
Thank you.
Any additional questions from Blackburn?
Nope, just thank you very much, Dr. Ahmed, and good luck in the new position.
Thank you.
Any additional questions from Windsor Star?
No, thank you.
Great. Thanks, everyone.